Hey everybody, it's Dr. Missy. Today is day 18 of my husband and I having the coronavirus, COVID-19. The only reason I'm posting today is this virus has me confused, so I thought it would certainly be confusing to the whole world. But I was looking at a Johns Hopkins study that just came out, and they've looked at their first number of patients, and they found that some of the story that the patients are giving are really similar to what Phil and I are experiencing, which is the first couple of days you have a dry cough, you don't really have much of a fever, 99.0, and then you get into maybe that wet cough area, which is, and a fever that's a little higher but less than 100. And that's when I recommend that you start the pulmonary toilet and the postural drainage, and maybe those breathing exercises I showed you, and the hot steam baths. I gave Gibson this very interesting haircut. He's got this unique little eyelash here, which he hates, I'm sure. Anyway, so for the first 3 days it was a dry cough, and then it was wet, and we started feeling bad. I was worse. I have been the whole time. Than Phil. Phil hasn't really had fevers. He hasn't had a lot going on in his chest. It's been more of a dry cough. I've done the percussions on his chest probably 3 or 4 times, and honestly, he's probably done it on me 3 or 4 times a day at times. Today, I've already had it twice. But anyway, I just wanted you to know that it goes from pretty severe symptoms to there's a day or two where you actually feel like you're getting over the flu, a lot's better. I've been posting how good I feel. And then bam, at about 8 o'clock, it seems to come on at night, my fever goes up. It's never really been above like 100.2. It's usually around like 99.5, 99.7. But my lungs get really bad, and I'm feeling like if I take a deep breath and cough right now, it's actually fairly dry. It's not too bad. I feel like I got pretty good wind, but I don't feel near as good as I did the last couple of days. And this is day 18. I mean, I was fine day 16 and 17, and then I was not so good a few days before, and then fine a few days before, and not so good a few days before. So it's like this little incremental thing. But this morning, the feeling bad felt worse than the normal feeling bad. So I did get a little concerned. We made a phone call into the hospital, and, again, they recommend that Johns Hopkins study showed that the people who actually get symptomatic COVID-19 will have symptoms that are really rather mild or almost imperceivable for a week, and all the way up to 6 weeks. So I'm thinking, oh my gosh, we've done 18 days. 6 weeks is 42 days, which means another 24 days of off and on symptoms. It's the most bizarre thing I've ever experienced or witnessed, and I just wanted you to know about it. But the recommendations are the same. If you're not having chest pain, if you're not having shortness of breath, and you don't have a fever of 100 or better, they're not recommending you go into the hospital because you're not probably going to need a ventilator or any advanced care things. The shortness of breath is the big thing. If you get shortness of breath, they want you to go in. My breathing's fine. I don't have chest pain. My temperature's been anywhere from 99.7 all the way down to 98.6 normal during today, and just wanted to give you a little bit of an update. Day 18 in a cyclical COVID-19 recovery that apparently is not to be unexpected. I didn't want it to take you by surprise. Y'all have a good day. See ya.